Hello, I'm Dr. Sandra Freyhofer. Welcome to our ACP 2021 Adult Immunization Series. The topic, Diagnostic Dilemma. Is it flu? Is it COVID? Or both? Or a side effect of vaccination? One thing is sure. In the midst of the COVID pandemic, there is nothing regular about this year's flu season. The only diagnosis worse than flu or COVID is having both, and you can. Both are respiratory infections caused by different viruses. Both viruses are circulating. Both are contagious, COVID more so than flu. And both spread the same ways, mainly by droplets expelled when those infected cough, sneeze, or talk, but also by touching contaminated surfaces or people, and then touching your own nose, mouth, or eyes. COVID's more likely to super spread, which means exactly what it says. Adhering to the 3 W's, wear a mask, wait at least 6 feet apart, wash your hands. These protect against both. First off, you can best get flu off the agenda by getting a flu shot. I hope everyone listening has or will. Flu shots are not 100% protective, but it is your best bet for staving off flu. It takes 2 weeks to build up protective antibodies, and CDC interim recommendations say try to allow a 2-week window between COVID vaccines and other vaccine doses. So with the current shortage of COVID vaccine, getting both in the time frame is still possible. Some of the symptoms of flu and COVID are the same: fever, chills, cough, fatigue, sore throat, runny or stuffy nose, muscle pain, body aches, and headaches. Some have vomiting and diarrhea, but this is more common in children than adults. What's different for COVID is loss of taste or smell. That usually doesn't happen with flu. For flu, symptoms usually occur within 1 to 4 days after infection. For COVID, the time from infection to symptoms is more variable, as early as 2 days, as late as 14 days, but usually around 5 days after infection. For both, you can spread these viruses before experiencing any symptoms, but with COVID, you're contagious for longer. With COVID, you can remain contagious for at least 10 days and start spreading virus about 2 days before symptoms, not to mention asymptomatic spread. Those infected with COVID can have it and spread it, even without symptoms. Those at highest risk of severe illness are the same for both: older adults, those with underlying medical conditions, and those who are pregnant. For healthy children, risk of complications is higher for flu than for COVID. However, infants and children with underlying medical conditions are at increased risk of severe disease for both. Most people recover from flu within a few days to 2 weeks. COVID can cause blood clots in the arteries and veins of the lung, heart, legs, or brain. It can also cause MIS-C, multi-system inflammatory syndrome, in children. For flu, we have a variety of FDA-approved antivirals that help and that work: oral oseltamivir and baloxavir, and inhaled zanamivir. Peramivir is also available, but it's IV. For outpatient treatment of COVID, we have limited supplies of monoclonal antibody for those at highest risk. There are 2 mRNA COVID vaccines currently available, but supplies are still limited. Other COVID vaccines using different platforms are under development. A new viral vector COVID vaccine is under FDA review and is likely to be authorized soon. Neither flu nor COVID vaccines are 100%, so for this season, this year, vaccination for flu and for COVID when available and when it's your turn, and universal adherence to the 3 W's are needed. Adding symptoms from COVID vaccination cannot be forgotten and adds additional confusion. CDC has helpful guidance. If you have fever, you must rule out COVID. Quick turnaround on testing can help people get back to work. So far this season for flu, we've been lucky. Flu has been very quiet and very mild. Social distancing, widespread masking, and hand hygiene likely play a role. Of course, flu season's not over yet, and COVID's still here. For the American College of Physicians, I'm Dr. Sandra Freyhofer.